Okay, good morning, everybody. This is Karen Hall from the P2 Collaborative, and welcome to the Introduction to Keys to Health, Unlocking Your Data Needs. This is part of our FIP webinar series, and FIP stands for Population Health Improvement Program. Before I turn it over to Samantha, I just wanted to let everybody know that this webinar will be recorded, and the slides and the recording will be posted on the P2 website later this afternoon. And we are also going to be muting everyone, and we'll take some questions at the end, but questions need to be typed in, and then we will feed those questions to Samantha. So without further ado, I'm going to turn it over to Samantha Lupinetti from Xerox Community Health Solutions.
Thank you, Karen. And good morning, and I'm excited to be joining all of you today. As Karen said, I'm an account manager at Xerox Community Health Solutions, and I've been working with Karen and the P2 team over the last few months to build this public health data platform that I'm really excited to share with all of you today. So just a quick overview of our agenda for today. We'll spend a little bit of time just going over sort of the background of our organization and the platform and reviewing some of the key features. We'll dive into what exactly Keys to Health, what the data that Keys to Health is going to highlight. We'll go over some of the indicators and data, and then we'll really spend the majority of the time going through a live demonstration of the site. So just a brief introduction to our organization and how it came about that we're doing the work that we're doing today. My slides now say Xerox, but Healthy Communities Institute was originally founded in 2008 in Berkeley, California, and was inspired by the Healthy Cities movement. So last year we were acquired by Xerox, but we're still sort of operating in a fairly independent fashion just under this larger Xerox Health organization. And we grew out of this challenge that we saw communities and health entities face, which was access to data. So the data on health and quality of life in our communities is often decentralized and inaccessible. It's tucked away in a spreadsheet or under a layer of query tools. And then even once the data is downloaded, it's in the format of numbers and tables, and that can be a little bit overwhelming and difficult to understand. So our solution to that problem is the technology platform. So it's a web-based information system that takes data from various publicly available data sources and creates local dashboards of health data that are more visually appealing and easier to understand. Oh, got ahead of myself there. So our signature feature is the community dashboard, which includes somewhere between 100 and 200 health and quality of life indicators at various geographies, and also provides them with some context so you can understand how your community is doing compared to other communities in your state or in the country. In addition, we provide some other public health tools. So there's a database of promising practices. There are some opportunities for you to highlight the current work that you're doing in your community, and also some tools for tracking your progress over time. And the ultimate goal with all of this is really providing your organizations, providing your organizations with this data, is to empower you to take some more informed action towards improving the health in your communities. So this is sort of an overview of all the tools that will be available on the Keys to Health site. We'll wind up going through most of these in the live demo today. Hopefully we'll have time for all of them. But just kind of generally speaking, we have some tools that will help you explore and analyze data. So we have that community dashboard, which is really where the majority of the data is housed, and probably where you'll spend the most of your time looking at the data. We have a demographics dashboard with the Nielsen-Claritas data, and then the Socio Needs Index, which is a tool that helps identify areas of socioeconomic need that are correlated to poor health outcomes. In addition to that, there are some tools to help you develop a strategy or strategies towards health improvement. So we have the CHNA guide that sort of offers some step-by-step instructions to assist you in that CHNA cycle or process. We have the Healthy People 2020 tracker to track progress towards meeting national goals. And then a data scoring tool, something that we won't have time to dive into today. But if you are in a CHNA cycle this year or completing a CHA, I definitely recommend maybe reaching out and letting Karen know, and that we can set up some subsequent trainings or calls to sort of review some of the back-end tools that we also have available for the CHNA and SHA process. And then lastly, there are some tools to help you evaluate progress and share your results. So you can create some customizable trackers or pages on your site. And then there's a resource library, which is an opportunity to host some of your reports and community resources. So kind of as far as system configuration, the website's covering the Western New York region, so it's including the 8 counties and all the zip codes and census tracts that fall in that region. There are approximately 140 HCI-maintained core indicators. We'll talk about those core indicators in a little bit. And, you'll see those lists may vary a little bit from county to county because you are a multi-county site, and that really just depends on the data availability. In addition, I mentioned there is Nielsen Claritas demographic data available on the site. And then you can see here we have the website URL. So we'll actually go into the live site today, and I will show you where the Keys to Health page or platform is housed, but you can also find it on the P2 website under Keys to Health. So again, I'm just going to give kind of a quick introduction to some of the data, and then we'll dive into the demo. So the platform I mentioned comes with a set of core indicators. This is around 140 indicators in New York State, and these come from a combination of national and state data sources. So around 60% of these indicators are going to be tied directly to health and 40% to quality of life measures. Most of the data is going to be at the county level, but there are some indicators that are available at the zip code and census tract level. And then, as I mentioned on the previous slide, there is also a regional view of the data that covers the whole Western New York region. Excuse me. So the framework for indicator selection with the health indicators is based on the Health and Human Services Healthy People Initiative. And when we're sort of determining these core lists by state, we try and align our indicators as best we can to a number of the Healthy People benchmarks, so that communities and your organizations can really track the important health and quality of life indicators over time. And when we develop these lists, we have a researcher who's assigned to each state. So I've been working closely with the New York State researcher who reviews all of the data that's available and then chooses this set of core indicators based on a couple of different factors. So it's looking at data availability, reliability, and validity from the source. So we're often looking at the granularity of the data, the source that updates the most frequently, and also for sources with breakout data, so that we do have the ability to look at some health disparities for some of these indicators. So just because I always get the question, I included a list of the different sources that are available on the site. From time to time this list may change, but right now these are the 20 different sources that we're using to pull data into the Keys to Health site. And you can see there that they are a combination of national and state sources. So in addition to the core set of indicators, P2 purchased an add-on of hospitalization and ER data, which adds an additional 32 indicators to this platform. So the hospitalization and ER indicators are based on the Agency for Healthcare Research and Quality's PQIs, Prevention Quality Indicators, which are a set of definitions for preventable causes of admission. So these PQIs are used to monitor how well certain conditions like diabetes or asthma are being managed in outpatient settings. And these, we sort of, the reason we offer the hospitalization and ED data package is that these indicators are important for communities to identify where prevention really needs to be focused. These conditions are sort of great for monitoring outpatient care and early intervention, inpatient and outpatient care and early intervention to potentially prevent needs for hospitalization. So, excuse me, the different indicators are listed out over here. We'll see these on the site, but it's the same 16 indicators. We're just looking at the hospitalization and ER rates as separate identifiers or indicators, excuse me. In addition to that core, the add-on of hospitalization and ER data, P2's also purchased an additional mental health package, and so these additional 10 indicators follow the same AHRQ guidelines and are just looking at 5 inpatient and 5 outpatient measures. And then I wanted to just mention local indicators. So far everything that we've talked about, or all the data that we've talked about, is data that HCI maintains or that we provide on the platform. But in addition to the HCI maintained indicators, there is the ability to add in local indicators to the site, either from data that you collect or from city, regional, or state data that you think might improve the quality of the site. So, you know, again, you're not limited to the, let's see, 180 or so indicators that HCI is going to maintain. If there are things that you're noticing in your work that are sort of missing from the platform and that you have access to, these are, you know, data points or data that's going to be continually measured or is measured on an ongoing basis, and that sort of rich data that you think would really add to the site, that's absolutely something that, that I can work with the P2 team to get added to the site. And then I mentioned that P2 purchased sort of an additional data package, and so our standard demographic package is just the U.S. Census Quick Facts data, but P2 purchased the Nielsen-Claritas package, which will include 100 demographic elements. These will be available at the regional, county, zip code, and I believe state level. So these are going to include some population, housing, economic, education, transportation, and occupation data. Again, the data is provided by Nielsen-Claritas, and I can provide additional methodology if that's of interest. But the one thing that I wanted to mention about this, and unfortunately it's not highlighted on the site yet, but we should have it up there in the next couple of weeks, is that we did recently for clients with the Nielsen-Claritas data on their site, we did add in some new charting features. And so this chart is actually something that I did create on the back end of your site. I haven't published it to the front end yet, but we do have the ability to take some of those demographic data points and put them into charts. So it can be bar charts or graphs or circle charts, and highlight some of that on your site. So I'm going to be working with Karen and the P2 team over the next couple of weeks to sort of figure out what some of those more relevant data points might be. But I would say if there are certain information that you'd really be interested in downloading in a chart format from the site, that's definitely something that you should let the team know, and we can kind of work on getting that up there. The one nice thing about these charts is that you're not seeing it right here, but there will be a little button and you can easily download these as a PDF or a JPEG and sort of insert them directly into a proposal or into a report. So that's something I'm looking forward to getting up on the site shortly. Okay, so the fun part, the live demonstration. Again, I'm sure you've heard about the Keys to Health site, so I think the best way to sort of go through and introduce you to a site is really just to dive in. Again, we have the URL here, but I have it already pulled up. Excuse me. Okay, so I mentioned that the Keys to Health platform is housed on the P2 Collaborative site. Right now, it's excuse me, listed under our work and then Population Health and Keys to Health, but I do believe from talking to Karen that there's also going to be a button on the home page at some point. But for now, you can find it here. I love the new logo that they just came up with, sort of mimicking the P2 Collaborative logo. So what I'm pulling up right here is essentially the landing page. So this is sort of where the HCI platform starts within the P2 Collaborative site. So the landing page is essentially kind of the home page for all of the embedded content. So all of the HCI tools and features can be accessed here. One thing is that this page is sort of entirely customizable. So over the next few weeks, months, or into the future, you may see that P2 makes periodic updates to the content, sort of switching some content out and adding in new stuff. But kind of going through just the layout that we have now as an introduction to the site, there are some sort of priority dashboards, that they highlighted in this drop-down menu right here. So, you know, as far as looking at the data, if you just wanted to look at all the health data, which would mean you're excluding the quality of life indicators, you could populate that there. If you want to look at a view of Western New York, which I believe is the default view right now, but you could pull that up here. same thing, we're going to go through a couple of the different dashboards today. So this is sort of just a menu tool up top. And then down below that, you have all of the icons that are linking you to all of the different HCI tools and resources. So we're just going to go ahead and kind of dive in. I'm going to do my best to get through as many of these as possible, but I think we sort of have it organized right now where some of the tools that you're more likely to use are lumped up towards the top. So under Find Health Data, this is going to take us to the community dashboard. And I mentioned earlier, this is sort of the signature HCI or Xerox Community Health Solutions tool. So this is really where the majority of your data is housed. This is where all of the indicators, so the core indicators, the hospitalization and ER indicators, and then in the future, any local data that you add are going to be pulled into this community dashboard. So kind of scrolling down, the indicators are grouped into 8 broader categories of data. So there's health, and then as we scroll down towards the bottom, we're going to see there's economy, education, environment, public safety, social environment, and transportation. And then within each of those categories, there are some subcategories. So fewer down here under these smaller topics, but up at the top, when we're looking at health, it's going to break all of the health indicators down into these kind of more familiar health subtopics. So kind of just looking at the page, these topic, subtopic, and then you have the name of the indicator with a clickable link to the indicator detail page, which is what we'll look at in a moment. You also have a click to the map. Again, we can access that on the indicator detail page. We'll pull that up in a second. You then have the comparison. So for them, I don't want to say the majority. For a lot of these indicators, it's going to be, you're going to see a combination of the comparisons. So I would say, I can't even, 50-50 split, but that may not be accurate. But a lot of your indicators are going to be compared to a distribution of New York counties. Many of the other ones you can see here being compared to a distribution of U.S. counties. And when I'm talking about the distribution, we'll go over here, you see the gauge. So the gauge was traditionally sort of the signature, in addition to the signature dashboard, the signature HCI graphic or image. So the distribution is highlighted in this colored gauge, which sort of visually represents how your community is doing compared to a distribution of the data. So this 3-colored dial represents the distribution of all values ordered from those that are doing the best to those that are doing the worst. The green area right here represents the top 50th percentile, the yellow the 25th to 50th percentile, and then the red area represents that bottom quartile. So the gauge is sort of a quick identifier. You see a gauge in the red, you know that you're in the bottom 25% of all counties in New York or in the country for that indicator. So, you know, from this page, you're not actually seeing the data value, but kind of from a quick review for, you know, at this point we're looking at Erie County. You can see that for many of these access to health services, compared to U.S. counties or New York counties, you're faring pretty well. You're in the green for all of these. So again, sort of that quick identifier. And then from the community dashboard page up top, you have the ability to decide how you'd like to view the data. So I mentioned, I think because I was playing around with it this morning, I'm looking at Erie County, but the default view, I think, might be the regional view. So again, this is going to show you all of the values across the 8-county Western New York region. But we can, some of the county level data I find is a little bit richer. You're more likely to have some of the breakout data that you wouldn't necessarily have at the county level. But you can go through and adjust locations. You can look at data by census tract, zip code, region, or county. The one thing I will mention is, and I'm sure for you data folks on the phone, you're well aware of this, but a lot of data, it's really hard to get data at the census tract and zip code level. So New York State actually does a great job. There are some indicators, some health indicators that we do have data available at the zip code level, I believe. But I would say if you're looking by zip code or census tract, this list of indicators is going to become considerably shorter, and it's usually a lot of the ACS, so the American Community Survey indicators that are available at the zip code or census tract level. Beyond location, you have the ability to search by breakout data. So on our sites, we're looking at age, gender, race, ethnicity for breakouts. And then this field over here the order by field. Right now, the default setting is to order by topic, so we went through topic and subtopic. But you can also look at the data just by status. So when I do that, you're going to see those subtopics sort of disappeared, and all of the indicators that are in the red suddenly populated up towards the top. So, you know, that first, when we first pulled this up and we're looking at the access to healthcare, it seems like Erie County was doing pretty well in that area. So we can see then some of the health areas where there's some room for improvement. So the gauges in the red, scrolling down, they're going to move into the yellow, and then those better performing indicators will be listed out below. So I wanted to hop in and kind of show you an indicator detail page. So this is the page that you would click on or link to if I were to click one of these indicators right here. And I actually pulled out a couple that I thought were great examples. They sort of highlight all of the different tools, and so we'll look at those. Tools, data available, features for the indicators. So the first one is adult QROBs, and I know that this is also a kind of a priority area or focus area for the FIP in the Western New York region. So one thing I just kind of wanted to point out, this indicator detail page that we're looking at right now is the same across all of those indicators included in that initial community dashboard list. So the system is incredibly uniform. All of this data is coming from various sources, from different sources, and so we've sort of done the heavy lifting in putting them into this template so that every time you come to an indicator detail page, you know exactly where to find the data that you're looking for, and there's a certain consistency in the way that the data is laid out and presented. As far as your page orientation up here, you have the name of the indicator, you have a detailed description of what the indicator is. Scrolling down, you have the region that you're looking at. So, you know, if you were looking at the regional view or zip code view, this would obviously not say county. It's located in the Western New York region in the state of New York. If you did want to view the data, you know, at this point we're just looking at it for a single county, but if you wanted to view it across all of the counties in your region, you could click this button here. It's a direct link sort of pulling up that data for you. We have the data source. So this can be helpful if you actually want to go back to the original source and pull up that data. I failed to mention earlier, but with the exception of the hospitalization, ER, and mental health data, all of the data that is available on the site is publicly, all of the core indicators are pulled from publicly available data sources. So sort of the appeal of the platform is that it's pulling together all of the data from those 20 different sources into this one location. But this is data that if you wanted to kind of go back to the original source, we do include that link so that you could access that original data set yourself. We categorize our data, so for search functionality on the site, there's usually going to be a technical note. A lot of times this has to do, especially with the indicators where we're comparing to a distribution, a technical note about that distribution. The maintained by field here in this case, this is going to say Healthy Communities Institute. Most of these indicators will for the time being, but at some point if there is locally maintained data or locally added data, that will populate with P2 Collaborative instead. And then the last updated date. So, so at this point, because we just kind of created the site and the platform, all of the last updated data is probably going to be within the last 2 months. Moving forward, though, you know, if 6 months from now, a year from now, we've had some data updates, this last updated date will update when new data has been added to the site. And that was really just the last, there's always some confusion between the measurement period and the last updated period or date. Measurement period is what the last measurement period that we have on record is. So in this case, it's 2014. But I'm sure many of you are familiar with the delay on getting kind of timely public health data. So our policy is to always have data data updated on our site within 90 days of the source releasing updated data. So it's really just dependent, you know, that there will be a delay sometimes. We'll have data that is 2 to even 3 years old up on the site, but that's really just a product of when the data source was last able to release updated data. Excuse me. Over here you have the gauge. The added benefit of being on the indicator detail page is that it's actually going to show you what those cutoff marks are. So in this case, we know sort of the 50th percentile is 30.6%. You guys are falling a little bit above that, but you can see now, not by much. And then again, you have the value in the comparison along with the measurement period. So if we scroll down here, there is a GIS map included underneath the snapshot. And so I will just pull that up to a larger view. So GIS maps allow you to sort of quickly visualize the health and quality of life indicators in your region. They follow the same color scheme that's used in the dash or in the gauge, and so you see the same red, yellow, and green, and that's going to show you where your county or region or zip code, if you're looking at that view, is in comparison to those neighboring regions. And so in this case, we're clicking on a county that we have the data value for. It's going to show you that value. The one thing that I just quickly wanted to point out, and you could spend a ton of time on maps alone, but you know, it isn't, the map again is kind of, at this view or this level, is really just going to show you that breakdown the same way that it would on the gauge, just in a visual representation, which can be nice for reporting purposes. But because you have the demographic, the Claritas demographic data, there is the ability to go in and overlay some data onto the map. And so this is something that we'd like to expand in the future. It's certainly not as kind of as comprehensive as we'd like it to be, but if you wanted to come in and overlay a population over the indicator, you could just sort of see where that the population in question, or the demographic point in question, is you know, least prevalent and most prevalent in the region that you're looking at. So you've got the little T here, and again, for any of the demographic data points, or for a handful of the demographic data points, you can go through and kind of highlight that on the map. So down below the map, you've got some, the why is this important section. This is some of the public health context. This is sort of helpful if you were writing a report or a grant. When there's a Healthy People 2020 target, you're going to see that target in bold. And then for most indicators, you're going to see a time series graph. And so in this case, this one's a little bit unique. This red dotted line here indicates that there's been a change in methodology. Typically, when possible, we like to have 4 different measurement periods for any of the indicators that we're responsible for on your site. In this case, because of the methodology change, we're just going to show kind of the previous value in that methodology, but we'll explain that in this case, BRFSS changed the way that they were measuring this indicator. So scrolling back up to the top, I just wanted to acknowledge that there are a couple of different views. So the default view, the first view that you see whenever you click on an indicator detail page, is going to be this county view. But there's also some different tabs. So in this case, I'll talk a little bit more about this, but we have added in some New York State prevention agenda targets for those indicators that are applicable. And so in this case, this is just giving you sort of a snapshot of your current value and then where the New York State prevention agenda has sort of set the target. So all of the rest of the context down below will stay the same, but you can see that target value. Same is true for the Healthy People 2020 target. So, you know, you can see actually New York State set the bar a lot higher, or in this case, I guess, lower, but kind of a more ambitious goal with Healthy People 2020. You're a little bit closer to that target, or very close to that target right now. So I'm just going to kind of quickly switch. I want to get into some of the other features and tools, but I did want to show you something that we're not seeing on this indicator detail page. So I pulled up another example, in this case, age-adjusted death rate due to diabetes. Everything up top here should sort of look the same. The one thing that's different with this indicator is in addition to the time series graph, you can see here we have, you know, we're looking at 5 different measurement periods. There are also some of those breakout tables available. So I believe I mentioned earlier that that's sort of something that we try and consider when we're figuring out what sources we'd like to use on the site. We do, when possible, try and get sources that do provide some breakout data. So that's certainly not going to be available for every indicator on your site, but whenever it is available, or that data is available, it will be included here on the indicator detail page in some tables listed out below. And then I think just the last thing about the indicator detail page I should mention is there is some related content listed out over here on the right-hand side. So in this case, we're looking at a diabetes indicator. There are going to be direct links to some of the other diabetes indicators on your site. There are some links to promising practices, so we'll go into that database in a moment, but you know, we do have a collection of sort of best public health practices on the site, and so you can click on some of those directly from this page. And then the same is true for some funding opportunities. Okay, so that was just the first, sort of the first, I don't know why let me go back to home. There we go. The first icon on the dashboard, but I recognize and I want to stress to you that that's probably where you will spend the majority of your time on this site if you're coming here for data. So that has sort of the hub for all of the data on the Keys to Health site, all of the health and quality of life data, excuse me. So quickly, I'm just going to dive in and show you the demographics dashboard. Again, this is just going to list out all of the different demographic data points. There should be around 100 listed out here. You can go up here and toggle the different view depending on how you'd like to look at the location, and then you can click on any of these. So if you wanted to sort of see all of the base counts on a page, you can look at that. You can look at it in a table format. There is the option of looking at some graphs and tables. Again, though, I want to stress that we're kind of moving into this idea of using a better graphing tool, and so rather than things appearing sort of in the gray and in this format as they are now, over the next couple of weeks, next month or so, we'll get some nicer graphs up on the site highlighting some of the more relevant demographic data points for your area. The next tool is the disparities dashboard. So these tables should sort of look familiar from that last indicator detail page that we were on. This dashboard is really just going to pull together all of the different breakout tables for all of the indicators on your dashboard. So sort of a way to allow you to highlight some of the disparities within the different groups in the population. It's going to give you that kind of quick snapshot, a quick visual way to identify some of the populations with greatest need. So something that I'll just mention, because I know it's a request that's come up in the past, these charts don't currently, excuse me, these charts don't currently list out confidence intervals, but that's something that we are working on kind of getting pushed out in the future. There's going to be a little bit of a facelift to the dashboard in general, and you know, rather than just having to sort of eyeball it and determine whether you think this may be an actual disparity, we'll include some of those confidence intervals, making it certain. So again, just a helpful tool to sort of look at some of the different breakout values on your site. So the next tool that I wanted to take a couple minutes to review is the CHNA guide, and this is listed as a community health needs assessment guide, and it is a little bit more focused on the CHNA and the IRS guidelines, but it really is a tool that can apply to any sort of needs assessment, so it can be helpful in the trial process or if you're going through a strategic planning process. And it sounds like, from talking to Karen, it sounds like a number of your organizations are in a CHNA cycle or a CHA cycle. So I definitely recommend kind of taking a look at this tool and seeing if it may be of value to you in the process. So the CHNA guide brings together kind of a number of resources, both those on your site and external resources to assist you in the assessment process in this easy to follow step-by-step format. So the first thing you'll see is that the guide sort of breaks the process down into these 3 different steps: assess, prioritize, and design. And for our purposes today, we'll just kind of click on assess, and I'll walk through the layout of the guide. So under assess, we see there are a series of sort of steps within that. And so this first one, define and understand service area, we'll look at this. And we'll kind of use this as an opportunity to walk through how the guide operates. So I'm going to click down here and expand all. So I see that the first step I need a different word other than step to kind of walk me through this, but under assess, under define and understand service area, the first step within that is to define your service area. So in this case, you know, some tips on what you may want to look at and some things you want to consider. There is a special important note for hospitals, and there is a direct link back to the IRS rule. The second step is to research the service area's demographics. Again, some things for you to consider. There's a direct link taking you back to the demographics dashboard on the site. So you can kind of take a look at this. These are some of the things I might want to consider. Let me go back and actually pull that data directly from the site. And something that I think is really helpful, and I've certainly used before in some of our consulting projects, are links to example reports. So, you know, we sort of highlight here in this case, we think that this medical center did a great job kind of highlighting the demographics in their report, and so there's a link to that report there. Step 3 is identifying zip codes with high socioeconomic needs. So that's going to take you into the socio needs index, which we'll look at in a little bit. And then down here below, there are always some tips for the final report. So just this is sort of based on our organization has the technology side, and then we have a services side. So some tips that we sort of pulled together from our experience writing CHNAs or completing jobs with health departments, sort of best tips or practices. And then again, because this is a little bit more focused on the specifically on the CHNA, we do have some direct kind of language pulled from the IRS rule, something that's sort of relevant for this section that you're looking at. So this sort of walks you through the first step, but I would say all of these subsequent steps or sort of phases, I guess, are going to follow a similar pattern. So you kind of go through, there are going to be some instructions. Again, I mentioned that with some of these, there's some helpful outside sources or tools. So something that I've definitely referred back to under prioritize, but we're skipping now sort of to the next phase. There's some great resources listed out for different prioritization methods. So I think the tool, again, it's sort of, the needs assessment process can be a little bit overwhelming, and something that's nice is that it sort of breaks it down into these more manageable steps. The last thing that I'll just mention is that there is an IRS checklist, and so, excuse me, sort of a good last-minute check as you're wrapping up your report or even working on your report to make sure that you're successfully kind of completing all of the different components that are required for that report. Let me see if I can get back now. Okay. So moving down into the next row of features, I've mentioned the Healthy People 2020 initiative, and then we saw on that one indicator that we had some of the, we had a target for the obesity indicator. This Healthy People 2020 progress tracker is something that is maintained by HCI, and it's based on the Department of Health and Human Services national goals for health promotion and disease prevention, which again I mentioned is sort of how the framework that we use when we're choosing our indicators in the first place. And so the tracker allows you to see how your community is doing compared to the national targets. So for any indicators that we have on the HCI site that match up, the definition matches up perfectly with the Healthy People 2020 measurement and definition, we'll pull those into this tracker. And so kind of similar to the indicator detail page, this is going to be in a uniform format. So you've got the name of the indicator, and you'll have your current value, the target value, sort of this quick visualization letting you know whether you've met that target or where you are kind of in comparison to that target. The since prior period, so you'll see there's oftentimes a lot of the equal signs. That's just an indication that there were overlapping confidence intervals. So, you know, there may in fact be a difference from the previous time period. In this case, it looks like, you know, there was a small difference, 89.4% to 89.8%, but they, you know, it wasn't a significant enough change to say that it's really moving the needle on this indicator. And then in the last column, you kind of have the status button, just a quick identifier of whether you've met that target or have not yet met the target. So in a similar theme or pattern, I mentioned that I know that for the FIPS and in New York State in general, the prevention agenda and some of those prevention agenda targets are fairly important. And so because we're working with a lot of the different FIPs in New York State, we created a prevention agenda tracker similar to the Healthy People 2020 tracker that has the prevention agenda targets and also is grouping the indicators according to the prevention agenda focus areas. So if you're familiar with the prevention agenda, these should probably look somewhat familiar. But again, we kind of went through for any of our indicators on the platform that perfectly align with, or the definition aligns with the prevention agenda target. We've gone through and identified those, and this is sort of laid out in the same fashion as the Healthy People 2020 tracker. Okay, so the socio needs index always takes a minute to load. Let me see if I can. Oh, yeah, there we go. So I believe I mentioned earlier, but we created a socio needs index. This is an HCI tool that we developed probably a year or so ago. That's a measure of socioeconomic needs that's correlated with poor health outcomes. So it's displayed on this interactive map where you can identify some of the zip codes in your community that have the highest level of socioeconomic need, compared in this case either to your region, or you can look at a selection that's really just looking at one of your counties. So as far as sort of how our methodology for this, all zip codes in the United States are given an index value from 0 to 1, 0 to 5. 0 being, I apologize, I take that back. All zip codes are given an index value from 0 to 100. So 0 being the lowest need, 100 being the highest need, and you can see that index value here. And then based on those index values, they're then ranked from 1 to 5. So the areas of, the 5 listed out here, but then also in the map legend listed as the darkest color. Those 5 correlate with the darker areas on the map, and they correlate with the areas of greatest need. The ones are going to be the lightest, areas on the map, and the areas of least socioeconomic need. So, this is information that you probably, you may already know, or may at least be sort of familiar with some of the zip codes in your county or in your region that are sort of struggling a little bit more. But again, sort of a quick identifier of those areas with greatest need. I will mention, just because I know that it's come up before, as far as sort of the factors that we consider when we develop the socioeconomic, socio needs index, the actual value itself. So it's looking at 6 different indicators, and they're coming from the topic areas that cover poverty, income, unemployment, occupation, education, and language. And those different areas are sort of weighted to maximize the correlation of the index with premature death rates and preventable hospitalization rates. So again, this is something, I know this is a map that a lot of times has been included in reports or sometimes in grant applications. The one thing I will mention is that the ranking listed here, the ranking does depend on the geography that you're looking at. So if you look at the whole regional view and say you have, 25s and 24s or something along those lines, this ranking is going to change. So, it's really dependent on the view that you're looking at. So just something to keep in mind with that. Okay, so the Compare Indicators tool. I think this is a nice tool if you want to kind of look at an indicator across some different geographies, which because you are kind of a regional site, you may in fact want to do or compare, you may just be working in a county but want to compare some values across the different zip codes in your county. So the indicator comparison report sort of quickly pulls together these indicators into a report. So I'm going to go through here, search obesity. It's going to pull up some of the obesity indicators on your site. Let's see. So we're getting a lot tied to diabetes with that search. But in this case, say we want to look at a couple of different counties. In this case, I'll just run it as a test. city report. You could add in some descriptive text, and then you can add in your email address. If you do this, then you're going to get an email with a link to the report. So this is something that you want to come back to, a report that you want to save and revisit. You'll have a copy of that in your inbox. I'm just going to run the report, and you can see now. So whereas that indicator detail page was just showing you the value for the one locale that you selected, the nice thing about the indicator comparison report is that it will show you a comparison. So again, in this case, I only selected the county values, but if you're working in one county and you want to compare zip code data instead, you can certainly do that. But it'll sort of the same identifying information. It's going to show you the gauge. In this case, it'll actually show you the value, your measurement period, your source. And so it's just going to do that for the two indicators that I select in that case. And again, that's something that you could edit and also save. You'll receive both of these links if you include your email address in that field. Okay, so promising practices. This might be the last thing that I sort of touch on today because I do want to leave some time for questions, but I do know that a big sort of task or I guess task with the FIPS in New York State is this idea of sharing best practices, and so that is something that that our site certainly helps to do. So the Promising Practices database sort of serves as a platform to share practices that show real potential in improving community health. So these are not all necessarily evidence-based practices, but they're a collection of practices that have been sort of shown to be effective or to be good ideas as far as moving that needle for certain indicators. So this collection is curated by our research team. They sort of scour far and wide to find programs and then do a write-up. There's also the opportunity, and I certainly strongly suggest and encourage you to do this, but there's the opportunity to submit a promising practice. So we'd love to have some local promising practices up on our site. In this case, if you submitted something through the site, it would be highlighted as a local practice. But actually over the last year or so, I would say a lot of the new practices that we're adding to the database have been submissions that have been submitted through our site. So as far as searching the Promising Practices database, there's sort of over 2,000 you can see in the collection right now, so there is some searching tools over here. I know that if we did just an obesity search, we'd come up with a bunch, and so yeah, 162 results. So maybe you only want to look at evidence-based practices, you only want to look at a primary target audience of teens, and if I run that search now, you're going to have fewer results. Excuse me. So let's just pull up one of these to give you sort of an overview. So similar to the the indicator detail page, we're pulling these practices from a variety of different sources. They're being submitted through different means, and so we've kind of put them into that same kind of uniform template or format. So you have the name of the practice. You do have a legend up here that sort of breaks down for you what our different classifications are for our practices. So in this case, this is an evidence-based practice that's going to go through what our criteria is for just determining that something's evidence-based. You have a description of the program, the goal, mission, the results, accomplishments, and then something that I think is really great and is helpful is this, the contact info. So in this case, whenever possible, we always try and have a primary contact with a phone number and an email address so that if you're going through and you're using this, the Promising Practices database more in that strategic planning stage where you've kind of identified the needs in your community, you're looking for ways to address those. If you'd like to contact someone tied to this program and get additional information, you have the tools to do so. So I think that covers everything on this page. Again, you can kind of go in and take a look at some of those if there are any questions, as is the case with all of anything we kind of reviewed today. Please just let Karen know and she can pass along my email, or it's included on the last slide. So in the interest of time, there are a couple other tools that we didn't get to today. Finding grants is just an opportunity. There is a collection of funding opportunities that HCI maintains. The one thing is that these are all national opportunities, but certainly something to check out. The resource library is something we'll be developing, and then the last reporting tool is something very similar to the indicator comparison tool, but something that also pulls in some promising practices and some funding opportunities. So on that note, we got through most of it. I do want to take the time to open it up for questions.
Thank you very much, Samantha. So at this time, we sent a chat that if you have any questions, please type them into the chat box and we can field them to Samantha. But while you're thinking of your questions, I just wanted to thank Samantha again for last week attending our Population Health Improvement Program public meeting. She gave this presentation in person, and I would like to thank her again for being on the webinar today. So this is, we are very excited to launch this website, and if anybody has any technical assistance needs as to how to navigate the website, you can please feel free to reach out to me through the P2 website. We have a link to technical assistance. If I'm not able to answer any of the questions, then I can certainly field them off to Samantha, and we can help you with any questions you have about how to use the site. And so also, in the future, we're hoping to upload any of our local data, so whether it's hospital data or health plan data or, data from schools or community-based organizations. So, please feel free to provide us your data so we could get this posted up onto the local site. And if I'm not seeing any questions right now, we can give it a few more minutes. So if anybody has questions, please type them in. Okay, we do have one question, and the question is, who utilizes the site most in communities? What organization?
So great question. It's really hard to say because I think it depends. So our clients in general are kind of across we span a couple of different health entities. So we do work a lot with hospitals. I think because of the ACA and the regulations for nonprofit hospitals to complete a CHNA every 3 years, that really sort of ramps up the hospitals that are using our platform. Typically, those are also the embedded sites, so they're putting the content, the data onto their sites, and then also, per the requirement, using the site as a platform to highlight the report itself and the findings. But we do work with a lot of, we've traditionally, I think our earliest clients were the health departments. So I would say a lot of health departments have some standalone sites that they've maintained for the last 4 or 5 years. And again, they use that for their CHAs or for FAB accreditation. So hard to say. I know that I feel like some of my most successful sites are the sites that are really used the most in the community. There's sort of the word gets out at the time of the launch, and then I think these sites really have become like the spot for public health data. And so I know a lot of times I'll see from some of my clients PowerPoint presentations where they said, oh, this community organization was submitting a presentation, and they wound up just linking directly to the data on the site. So that's probably not the answer you were looking for, but it really does just depend, especially because we work with so many different types of clients. The different users and visitors to the site really do vary.
Okay, thank you. And I also have 2 more questions. The first question, is Xerox Community Health Solutions accessible by anyone or only clients? If only clients, how broad is your network?
Sorry, so is that asking whether the site is accessible to anyone, or I'm not sure that I'm clear on that.
Yes.
Okay, so good question. The site is accessible to anyone. So it's up on the P2 website. There are no restrictions or there's no limitations on who has access to that. So it really is a site for the public. And that's, that's an audience that I didn't even mention this last time around, but I've had some great examples of hearing back from clients where, you know, an interested community member who really didn't have anything to do with health wound up finding out about a problem in the community and sort of spearheading an issue around that. So definitely available to the public. The one thing, there are some tools that are currently not front-facing tools. So the one I mentioned was the data scoring tool. So I would say not a lot of tools. There's that one in particular. There's also the ability to download a CSV file of all the data. That's really just something that that Karen or an administrator of the P2 site can do, but that's something that she can certainly share with any of you. So 99% of the data is available on the site and is available to everyone. But you know, if for some reason you wanted just a download of the raw data or are interested in sort of seeing this data scoring tool, that's something that I could help Karen pull and provide to you.
Okay, and then to add to that, are the promising practices available to anyone?
Yes, absolutely.
Okay, so the other question that came in was, this question came on a little bit late, so maybe you did cover this, but the question is, I noticed some data 2009 to 2011. Is there somewhere to go to see the years of the date, or can you only know when you drill into a specific area?
Great question. So something that I didn't cover today, just in the interest of time, but that I did mention for anyone who was also joining us in person last week. Currently, no, and I realize that's sort of a frustrating, you know, a frustration of the current system, but we are going through this large data visualization process, and so that, I kind of mentioned this a little bit last week, but that's going to redo or kind of give a facelift to the current community dashboard. And one of the things that was important, some of the feedback we got from clients, is that they would like to know when they clicked on an indicator, all of the different time periods that were available. So with DataViz, which will probably be out sometime in Q2, there's going to be this indicator summary page, and on that page it would tell you all the different time periods for which the data is available. So I apologize, it's not functionality that's built in right now, but it is something that you will see in the next 6 months or so.
Can you explain what Q2 is?
Oh, yes, sorry. So sometime between April and June. So we're kind of working through some of the infrastructure right now, but then we're hoping, I don't want to put an actual date on it because I know with development that always gets pushed back, but we're hoping to have something out by May of this year, June at the latest.
Thank you. So any other questions before we sign off? And also, just to let folks know that we do have a survey, so if you could please complete the survey, it will pop up right onto your screen as soon as the webinar is finished. So if you could please take a few minutes to complete the survey, we would certainly appreciate that. And I'm not seeing any more questions popping up, so thank you again, everyone, for joining us today. And again, thank you to Samantha for joining us today. If anybody has any questions in the future, then please feel free to reach out to me through our FIP website. Have a wonderful day, everyone. Thank you.
Thank you.